It's not the diamonds. Tummy tuck recovery, let's talk about it. Sorry, I just felt a little nice in my Beyonce shirt, my Beyonce merch. All right, here are the 7 biggest questions that I get asked about tummy tuck recovery. Ready? Number 1, can I shower? So this is surgeon dependent. I allow patients to shower the day after surgery because out of anyone know how yucky you can feel when you're in pain and you're dirty, right? And it actually is very safe. There's been no evidence to show that waiting 48 hours or 72 hours, some of these arbitrary numbers that we've discussed in the past and have used in the past, actually make a difference in terms of infection. So it is safe to take a shower, and I recommend that you do. But again, consult with your surgeon before you do so. What is not safe is taking a bath. Sitting an incision in water before 6 weeks on the body is not safe. When you talk about hands or face, that's a little bit different. But when it comes to tummy tuck, do not sit in a jacuzzi, a bath, the ocean, the pool for at least 6 weeks until after your surgery. Number 2, how tight are you gonna pull me? After a tummy tuck, normally what I tell you is I'm gonna pull you extremely tight. As tight as I can without causing an issue. And what that means is that on the table, when you're on the table, you're actually going to be kind of head up a little bit, so a little bit flexed at the waist. And that's the same for your recovery. You're gonna be bent at the waist for at least the first couple days, if not the first week, if not the first 2 weeks. Your body will tell you when it's slowly safe to sit up, but it will feel very tight, and that is very much intentional. Do I need drains? Drains are again surgeon dependent. Not every surgeon puts drains in. Surgeons who do not put drains in typically do what's called quilting or progressive tension sutures, so they can minimize what we call dead space. Dead space just means that we have lifted up the abdominal skin and are putting it back down, and by doing so, we're creating this space, and when the body has dead space, it wants to fill it, and usually it fills it with fluid. So one way or the other, the dead space has to be reduced. So you can either do that by putting in drains, which help to create a little bit of scarring, but also mostly help to evacuate extra fluid, or you put in progressive tension sutures. If your surgeon isn't planning on putting drains, please ask them what is their procedure for reducing dead space. They'll be impressed by how smart you sound. How much swelling is normal? So believe it or not, you can be quite swollen after the surgery. And it may not be as telling in your belly, but your vagina will be quite swollen. And that is normal. Yep. Swelling should not be mistaken for things like a building fluid collection, however. So if you have a building fluid collection, that is immediately talk to your doctor, go to the ED, reach out to your nurse. Somebody needs to know about that. But swelling itself is very, very normal and can be prolonged, especially in a tummy tuck, because we're lifting all of that skin up. And by doing so, we're cutting off a lot of the drainage that normally is attached to that area of skin. That drainage has to grow back, and it will grow back, but it's a slow process. So you can expect to be swollen with improvements every day, of course, but you can expect to be swollen for up to 3 months, thereabouts. Now, the next question I get asked is, how important is it that I have lymphatic massage done? So lymphatic massage has become a buzz phrase that people now recommend after BBLs and lipo and tummy tucks. But it's an expense, right? And because it's a buzz phrase, because it's a catchphrase, there are a lot of people out there claiming to do lymphatic massage therapy. Shout out to those people, because I don't think they're crooks. I don't think they're stealing your money. I do think they provide a good service. However, it does come at an additional cost. Lymphatic massage does help a lot with swelling. And so for that reason, I would say it's a good idea. However, I think it'd be strong of me to say I recommend it, because truthfully, the swelling will go away either way. What I do recommend is massage at home that can be done by you, your partner, or whoever is helping you, but mostly you. And that massage can be progressive. It can usually begin 2 weeks after your surgery, and it can be progressive and can be as deep in pressure as you can tolerate. So again, it does not require that you go to a masseuse who's certified in lymphatic massage therapy, but I think massage is recommended overall. But I do not think it is necessary to pay an additional person to perform lymphatic massage therapy. I laugh because I have some patients who have had tummy tucks and who themselves are lymphatic massage therapists. And so shout out to them. I believe in what you do, absolutely. Not trying to kill your bread and butter, but I want to keep it real about what people need to do and not do after tummy tuck. What are some scary things to look out for after an abdominoplasty? So I did say swelling is normal, bruising is also normal, but bruising to the point where the skin gets really, really, really dark can be concerning, especially if that dark area is consistent, meaning that it's all contiguous, it's all connected in one area. And if that part is at the bottom of the tummy, so right along the incision or right near the incision, right above the incision, right in the middle underneath your belly button. That is the part of the abdominal skin that gets the least amount of blood supply after tummy tuck. So if that area gets really dark purple and is contiguous, I am concerned that that area may actually die and you may have a wound there that needs to be taken care of. So something to look out for, something to talk to your doctor about if you notice that before you see them in clinic, and something to ask them about also if you notice it. The other thing to be wary of or scared of is bleeding. And I don't just mean bleeding that you see at the skin and you can put your finger on it and it stops. Bleeding, right? You don't want to see any rapid forming fluid collection, meaning that let's say it's day 2 after surgery, you're at home laying down and you slowly see your belly grow over the course of a few minutes, a few hours. That is concerning for bleeding, active bleeding. It may cause you to be more lightheaded, to feel dizziness, to feel very dehydrated, to feel very thirsty. This is all scary and means immediately call your doctor, call your nurse, go to the emergency room. Do not hesitate if you feel like you have certain growing of your abdomen, and especially if you feel lightheaded or dizzy with that and it's getting worse, absolutely go to the emergency room. Now, is lightheadedness or dizziness normal after surgery? Yes, it can be. Within the first 48 hours, you're still very much under residual effects of anesthesia, and so lightheadedness and dizziness can be normal. However, it's one thing for it to be stable or to be getting slightly better. It's another thing for it to be getting worse and worse because you're actively bleeding. So absolutely seek attention if that's the case. Now, there are other complications that are less scary. So what are those? So those can include things like regular bruising all over the abdomen. If you had the tummy tuck or abdominoplasty combined with lipo, then you could be pretty badly bruised. And mostly you see that kind of on your flanks or on your waist, potentially, depending on who your surgeon is. The drain falls out. If you have a drain and it falls out, that is not an emergency. Let it go. It's not great, but it's not the worst thing in the world. But what would be worse is if you tried to put it back in. If it's falling out or it's fallen out, do not attempt to reinsert it back in. Remember, your inside is sterile. The outside, including your skin, has bacteria on it. So if you take something that's been outside and don't sterilize it and put it inside, you are now introducing bacteria where there were none before. So do not put it in, do not try to salvage it, just let it go. A seroma also can be a complication of abdominoplasty. And what a seroma is, it's a buildup of fluid. It should not be confused with the rapid buildup of fluid that comes with bleeding, and that is usually typically a few days or within the first 24 to 48 hours after surgery. A seroma can slowly build up, and it usually happens in a way where you just see some, again, increased girth in your belly that you didn't notice before. And actually, if you push on your skin, it feels like there's like a fluid wave underneath. That is something to talk to your doctor about. It is not an emergency, but it is urgent because you want to drain that fluid before it becomes infected. And again, bleeding that you can put your finger on and it stops is annoying, but not scary. And that's exactly what you should do. If you see a little bit of bleeding at your incision, put your finger on it. Not a whole bunch of gauze and then your finger, but your finger. And wash your finger afterwards. You want digital pressure from your digit on it. When you put gauze on it, what you're doing is you're spreading out the pressure. But when you can maximize the pressure in one point, that's going to be the best remedy. If it does not stop after 5 to 10 minutes of direct digital pressure, not gauze pressure, then obviously call somebody. But before then, just try to stop it with your finger. And again, if your vagina is a little puffy, that's totally normal. Again, it's annoying, but it's not catastrophic or scary and should resolve and improve with time. And those are most of the questions that I get for recovery after tummy tuck. Do you have questions? Please leave your questions in your comments below. Like and subscribe, especially if you were feeling the merch today and the look today. Okay. By the way, the concert is amazing. But anyway, you didn't tune in for that. Love you lots and bye for now.